Respiratory illness is increasing in frequency all across the state and even the country. Things like COVID, flu, and RSV. One of the leading measures to track those cases is through wastewater testing. And today I visited the Kent County lab where they are testing wastewater for COVID, about how it works and what they're seeing in the community. Testing for diseases is not glamorous, especially when dealing with.
We're looking more at feces in this.
But for Andrew Salisbury,
so this one's really cool.
He's the supervising sanitarian at Kent County Health Department. He took us inside the lab where they test wastewater for COVID.
We've been able to detect cases in wastewater up to a few days before people are even symptomatic.
There's about 20 sites across Kent County, but many more in the program across the state. Many of the samples in this lab began with prep done at Grand Valley State University.
Full liter of wastewater per site comes down to 96 little wells like this.
It's analyzed in these machines and gives a clearer picture of the diseases in the area than testing alone can do. Inside these vials shares the story of COVID in your area, for which is increasing this time of year.
This time of year, we're seeing a lot of rise in overall communicable disease like that. So we are seeing a slight increase in COVID numbers across the county, as well as some isolated spots in our facilities.
And across the nation.
CDC is seeing the highest numbers of COVID wastewater concentrations that they've seen at least over the last 12 months.
Here in Michigan, the state's deputy epidemiologist says Michigan and the Midwest is seeing higher levels than some areas in the country.
I don't think we are over our peak yet necessarily for RSV. Definitely not over our peak for COVID, and influenza is just starting.
Back in the Kent County lab,
one exciting thing to come in the new year is we are going to add RSV and norovirus.
They continue to turn what you flush down the toilet into valuable information. And remember, there are updated vaccines for both COVID-19 and influenza to help prevent getting those diseases this time of year. Talk to your doctor about scheduling to get one. It's not too late.